Good morning, everybody. Welcome to the Snap to Skills webinar using data to assess and improve Snap ENT. We're going to get started in about 1 minute, so hold on and we'll be with you in 1 minute. Okay, good morning, everybody. Again, welcome to the Snap to Skills webinar using data to assess and improve Snap ENT. My name is David Kaz. I'm with Seattle Jobs Initiative and a part of the Snap to Skills team. Snap to Skills is a project of the USDA Food and Nutrition Service that is designed to provide states, their partners, and other stakeholders with the technical assistance, tools, and resources they need to build more effective SNAP ENT programs. And a key part of our work is providing learning opportunities, such as our webinar today. In a minute, I'm going to turn it over to our facilitator, Julie Strawn of Apt Associates, who is also part of our Snap to Skills team. But just a quick note on logistics. We really do want to hear from you, so please feel free to ask questions of our presenters, and you'll do so by typing into the question box at the bottom of your control panel. And to use that, you can collapse or open your control panel by using the orange arrow, which should appear at the upper right of your screen. We're going to save questions until the end of all presentations, but you can type yours in at any time as it occurs to you, and at the end we'll get to as many as we have time for. Please indicate if your question is directed to a specific presenter, otherwise we'll assume it's open to any presenter. And now, without further ado, I will turn it over to Julie Strawn. Julie.
Thank you, David. Hello, everyone. I'm just going to quickly go over what the webinar will cover and our speakers. So today's webinar is going to focus on several key questions. First, what type of outcome data and other information should states consider collecting and analyzing to see if SNAP ENT is achieving good outcomes for participants? Second, where can they get this data and through which mechanisms? How can states use the data to tell their stories, show return on investment, and continuously improve their programs? And finally, how can SNAP ENT agencies use that information to identify and manage effective third-party service provider partnerships? We have a terrific slate of speakers to address these topics. Our first speaker, Loretta Robertson with the Office of Employment and Training at the Food and Nutrition Service, will share information on new national initiatives to make effective use of SNAP ENT data at both the federal and state levels. Our next speakers, Sheila Lewis and Christina Eckenroth from the U.S. Department of Labor, will share insights from a recent project that supported 6 states to explore strategies for using performance data to demonstrate programmatic achievements, challenges, and stakeholder return on investment. They will also describe a new tool developed by DOL and the Department of Education that states can use to assess current capacity, to use cross-program performance data to inform decision-making. Next, we will hear from Andrew Prihar from the state of Pennsylvania's Department of Social Services, who will describe how Pennsylvania is making effective use of data to understand SNAP ENT outcomes and make program improvements, including strategic planning, case management, and setting and monitoring performance expectations for third-party partners. Our final speaker, Shavana Howard, will share how Washington State is collecting and using data from its well-established SNAP ENT program to improve program outcomes and grow and manage third-party partnerships. She will also cover recent work her agency completed with the Seattle Jobs Initiative to survey all third-party ENT service providers on ways to improve and streamline overall program administration. After our speakers, as David noted, we'll have time for your questions, so please do feel free to type in questions at any time during the presentations, and we will turn to them at the end. And now I'll turn it over to Loretta Robertson to start us off.
Okay, hello everyone. As Julie said, this is Loretta Robertson from the SNAP Office of Employment and Training. I just wanted to talk a very brief few minutes to kind of give a layout from the national perspective, from the FNS perspective on how we're coming to look at the data. Can we go to the next slide? Great. So as I think everybody has probably heard us talk over the last couple of years, how FNS has come to start looking at the data is really looking at the data in its totality and looking at all of the sources of the data. And so that really starts with the state plan, where the states lay out what they plan to do in terms of their ENT program as far as the types of services they'll be delivering, the targeted population, how many they intend to serve, and all of the constraints of the program. And the next then goes into the 583 data, which is, everybody is aware, that's been our one report that's been in existence, I guess, from the beginning of time for the SNAP ENT program, and that is really the participation data that lays out exactly what the state did do in terms of individual participation as well as the component participation. And then the new report is the annual outcome report, which kind of ties it all together, that really looks at the outcome of those services that were delivered through ENT. So that's the data life cycle, and so we're looking at that in its totality. Can we go to the next slide? So I just wanted to spend a few minutes to talk about some of the initiatives that FNS is doing the last few years and will continue to do in looking at the data. So we have the FNS 583 participation reports. And so last year we modified the 583 report in terms of the components in particular. And one of the things that we did is we removed the use of what was called the unique component. Many states had what they considered as a unique component because maybe it had coupled a couple of activities together, and so they reported as a unique component. So when we looked at the data at a national perspective, we really could not tell from that unique component exactly what were the components or what made up the activities that individuals participated in. So we removed the use of the unique component to try to streamline and have consistent kind of reporting components. So that's one of the things that we did last year on the 583, and we're going to continue doing some further refinement and clarification of the 583 as we go into the next few years, and particularly after the Farm Bill implementation, after the rule. So look for continued changes to the 583 over the next couple of years. The next initiative that we had is the Data-Driven Process Improvement Contract, which internally we had come to call that kind of our little data contract. And that, I'll talk more at length about that in a minute, but it was a very short-term 8-week contract that actually I think ended up being about a 21-week contract. And now the big initiative that we've got going on that's going to be a long-term initiative is conducting the assessment of the collection, analytics, validation, and reporting of SNAP ENT data. So we can go to the next slide. So with regard to the little data contract, what that contract did, as I said earlier, that was really intended to be a quick turnaround 8-week contract that I think we extended another 16 weeks. And so what that contract did was it took all of the information for fiscal year 18. We had a contractor that compiled the information from the FY18 state plans, some of the data elements in the 18 state plans. They pulled in the data from the FNS 583 reports, and then they pulled in the information that was reported through the state's annual reports. And so it was looking at all of that data, again, in its totality. And we had two deliverables from that contract. The first deliverable was the production of the state annual outcome summary for each individual state. And so that will provide a one-page, actually it's a two-pager, a two-page overview of the state's E&T program. It'll show the employment and earnings outcomes that the state reported to us for fiscal year 18 through the 18 outcome report. It will show the participant characteristics that were reported, as well as 3 of the state component measures that the state reported to us. So that's going to be a one-pager. Those will be eventually posted on our website, available to state agencies and the public. The second deliverable was a technical assistance table. And again, that is taking a look at the totality of the FY18 data. So it shows the information from the state plans, some of the key program characteristics as far as the areas that E&T is provided, the target population, whether or not a state was a pledge state, and it had the total program budget. Then it's looking at the program data, comparing the data that was projected in the FY18 state plan, looking at what was reported in the 583, and then also looking at what was reported in the annual report. Then it also looks at the component participation, again, comparing what was a projection for the state plan compared to the actual participation through the 583. Lastly, it looks at the outcome measures that the state reported to us for those national measures with regard to employment and earnings. And then lastly, that technical assistance table identifies any kind of technical issues with the data that came as a result of looking at the data in its totality, as well as flagging some possible program improvement areas. And so these technical assistance tables our regional staff will be using with the states in this upcoming year. Again, looking at it from the national perspective at trying to look at the data all in its totality. So the next slide, please. So I think the biggest initiative that we have going forward that I'm extremely excited about is the assessment of the SNAP E&T data collection. I think one of the things that we really realized once the annual report data, the rules were finalized and we started getting the annual report data was we, at a national perspective, really needed to have a better system to be able to look at all of this data that was coming in, again, from the state plan through the 583 as well as from the annual report. So this is a 3-year project, and our contractor is Mathematica. And so that project is going to identify and describe the current state and the federal systems that are used to collect, validate, and analyze E&T data. It's going to assess the current and future E&T data needs at both the federal, regional, and the state, using information and focus groups from federal, regional, and state staff. And finally, they're going to make a recommendation as to a plan for us at the national level, how we can improve both for a federal, regional, and state staff perspective to collect and utilize the data for the E&T program and improvement. So some of the key tasks that are going to be happening through that 3-year project is conducting in-person meetings with national and regional staff. Those have already started. We're going to be selecting 7 states that the contractor Mathematica will go out and observe the state E&T business as far as the data collection and the analysis processes that they use. And then they'll be creating some process maps showing how ENT data flows through the state, regional, and federal layers. So that's a very exciting project, and as I said, it's a 3-year project that's going to be continuing on. So with that, I am going to turn it back over to Julie. I'm really excited for our federal to listen from our federal partners as well as our state partners, and hope everybody has a good webinar.
Thank
Julie?
you, Loretta.
Okay.
Let's turn now to Sheila Lewis and Christina Eckenroth from the U.S. Department of Labor.
Thank you, Julie. Welcome, everyone. This is Sheila Lewis from the Employment and Training Administration of the Department of Labor. Welcome, and thank everyone for joining us today. And we also appreciate the invitation to join this event. Today, we'll be providing an overview of our Maximizing WIOA, or that is Workforce Innovation and Opportunity Act, and non-WIOA Performance Data Cohort. On behalf of the Department of Labor's Employment and Training Administration, and on behalf of the Department of Education's Office of Career, Technical, and Adult Education, or OCTAE, and their Rehabilitative Services Administration, or RSA, we thank you for taking the time to participate in today's event and to hear about some of the work that was done during our most recent performance cohort. Again, I want to reiterate this project was a collaboration between Workforce, that's ETA, Adult Education, or OCTAE, and RSA, or Voc Rehab. So today we'll be sharing some of the promising practices that our cohort teams discovered around maximizing performance data, along with some of the different activities and resources that they were able to produce around their data. To provide you with a little background about this cohort, we discovered that states were at both ends of the spectrum on using their data. Some states were in the middle. So we decided to collaborate with our education colleagues to study the development or the collection of data with our states, just to see where they are, and hopefully to develop a tool in the end. So that's what we did, and the tool, we call it our final project or our capstone product. It's a resource that was developed by the cohort participants for the purpose of helping other states address challenges that they may be facing around maximizing their performance data. It's called the Maximizing Performance Data Development Model. You may hear us refer to it as the model or the data development model. Hopefully you will learn more about the data development model and how it works, and you'll find ways in which it might be useful to your efforts that are already taking place within your program. Next slide, please. Thank you. So, as you may or may not be familiar with the collection of our performance data under WIOA, we were collecting a lot of data. States were still in the process of implementing WIOA. They're still programming their MIS systems, and we, in fact, are actually still implementing the performance provision of WIOA. So we began to understand that, there's a lot of data coming in, and, states weren't really focused yet on analyzing it, on telling the story that the data represents, and on sharing that data with their stakeholders. What does all this data mean? How do we use this data to improve our programs? How do we use the data to service our customers? So we discovered that we need something. We need to help the states. States needed assistance on data visualization, on software, data analysis software, and as you know, sometimes there's lots of turnover. So we need data analysts who are available to who are able to analyze the data. So what does all this mean? And we have a lot of information that we can communicate to our stakeholders. How do we communicate it? How do we communicate it effectively? We saw lots of dashboards that were either too busy, not busy enough, or they didn't really tell a great story. So that's why we came together to develop this this cohort. You can move on. Next slide. So we developed this cohort. The cohort consists of participants from on the education side from Voc Rehab, adult education, and on the labor side from workforce. And they were also invited to bring in some of their other partners. So we sent out applications, states responded, and we selected 6 states, as you see there, Arkansas, Indiana, Kentucky, Massachusetts, Minnesota, and Virginia. And the states were selected based on the states that had submitted all of their program year 2017 annual performance reports for their various titles, which is titles 1, 2, 3, and 4. And especially if they had submitted their information on a timely manner. We also selected the states based on geographic diversity, state size and population density, and state organizational structure. We also made our selection based on the quality of their applications. And also we took a look at states that had made great strides in their utilization of performance data to demonstrate programmatic success. Also, those states that were still working to fulfill their statutory provision of WIOA performance, and also states that would categorize themselves as falling somewhere in between, leaders and learners. So you have the states there that participated in our cohort, and let's see. You can move on to the next slide. So again, the purpose of our cohort was to understand where states are using their performance data to demonstrate their programmatic successes, their challenges, and their return on their investment, and also to give them an opportunity to share and learn from one another as they discuss their efforts. The participants were able to identify common challenges around performance data, maximization, and to exchange innovative solutions that had proven successful within their respective states. Another purpose of the cohort was to have the participants work together to collectively develop a resource that would that they could use to assist each other to demonstrate their programmatic outcomes. And again, I alluded to that before, and that's our data development model. So I'll hand off to my colleague, Christina Eckenroth. Next slide, please. Christina?
Thanks, Sheila. Hi, everybody, and thanks for joining us today. I'm going to pick up where Sheila left off. So a lot of our programs had a lot of the same questions that you're discussing here. So this is probably going to sound pretty familiar to you. The work. So what, again, were these people doing in the cohort? So the participants met both in person and virtually. You can obviously see the geography is pretty dispersed. So they met in person and virtually, and some of the basic big picture topics that they addressed are here. So really, what are we doing with this data? Like, what information can we get from it? Because successfully filing the report, although required, is really not the point. How do we know how to use the data to demonstrate a couple of things? Our programmatic achievements, what challenges our program has, and what the return on investment is. Where is the bang for our buck? Next slide, please. So the goals were, as Sheila indicated, pretty broad. Number one, they were trying to figure out, who are my partners exactly? We throw that around a lot, but does everybody know for sure who your partners are? And then, like, what data do you share with your partners, and what data do they need to share with you? And why? And how are you going to get it? And then to Sheila's point about taking a look at all this data, so what analysis should I be doing to reach my goals here? How do I find out how my programs are doing? Are we serving our target demographic? What kind of interventions or approaches are most successful? Where do we need to make improvements? The next item that the group was taking a look at is, helping other states to think about these questions. And we're going to talk about that a lot since this is the purpose of our section here. We developed some tools that hopefully you can use. Wanted to, of course, work on their own agenda. They had to solve their own internal state issues. What were their own goals? And so that was what the cohort was talking about here. Next slide. Big questions. You're going to have these same questions, I suspect. This group wanted to drill down specifically to these areas, okay? Program definitions. Are we all talking about the same thing? The important thing about Workforce Innovation and Opportunity Act, which is our legislation, is that it did, in fact, standardize terminology and performance metrics across a group of core program and partners. So we all are talking about the same thing when we use terms like participants or employment indicators, and who's employed. So previously, not everybody was talking about the same thing, and that's important to know with your partners. Are we all talking about the same thing? Is what I say to you mean the same thing? The next issue was the development and utilization of state-specific performance indicators. So what the federal government wants to know is often maybe not always what you want to know. I don't know if that you've experienced that. You might want to know something special or different. So what is that you want to know that would be useful to your partners or your stakeholders? You need to find that out. And then the state and local level understanding of the value of the WIOA performance data. So insert here the value of the SNAP-ENT data. Sort of understanding what it is they're looking at and why it matters. And then there were those system-wide efforts to measure state and local performance in real time. I'm sure a lot of you are familiar with the Department of Labor services, employment services. They are provided through American Job Centers, and those are funded to state grantees and then funded down to locals and delivered locally. So there's data at a lot of different levels. And for us, the state's challenge is to not only make it useful for federal folks, useful for state folks, useful for the local staff. So that is what we were trying to address here in this cohort, and I think they did some really great things. And with that, I'm going to turn it back over to Sheila to talk about outcomes. Sheila, do you want to talk about our outcomes?
Oh, sorry, guys. I had my phone on mute. Thank you, Christina. So as I alluded to before, the cohort had one primary outcome, and that was our maximizing performance data development model. And as you see here, the model includes 3 sections: a self-assessment tool, tools and resources were identified by the cohort teams, and also they developed a facilitation guide. And also each state team developed their own action plans toward maximizing their WIOA and non-WIOA performance data. So I'm just going to give you a brief overview. Christina's going to give you an overview as well of the data development model. But basically the model, the first part included a self-assessment tool. That tool included several different levels where we asked the state teams ask themselves questions so that they can assess where they were on different levels. There were 5 different levels that they could assess themselves. And at the end of our presentation, there will be a hyperlink to all of these resources. So you'll have those so that you can modify them for your programs in your various states. But our state teams were able to assess themselves based on as I said before, based on 5 different levels, and they were asked several different questions. The first question is leadership and partners. To what extent do your state's leadership and partners see the importance of data-informed decision making, and to what degree do they begin with data? The next question was using and integrating data. To what extent is your state using and integrating data to inform policy and operational decisions? The next question is resource needs. To what extent has your state identified and met resource needs to enable you to effectively use data for decision making at all levels? The next question is about data governance. How would you describe your state's data governance structure? Is it a formal approach to securing and managing data, or is it informal? So those were the primary questions asked on the self-assessment tool. So then we asked the state teams to identify other tools and resources that they would need in their data collection and data analysis. So we have a whole list of those that they're available later on for you to review. But I'll move on to there was a facilitation guide that helped the state teams move through this process. And then we had the states develop their state action plans. We have some excerpts from the state action plans, and Christina will go over those a little later. Next slide, please. All right, so I'm going to back up to the states again. They use the self-assessment tool to help them to diagnose where they are as organizations. We believe in going back to the beginning, figuring out, where are you in this process? Are you a leader? Are you a learner? Are you somewhere in between? And then the next step was we use the step for determining, how they're making their progress. Again, they identified a series of tools and resources. So I'm going to turn it back over to Christina. And next slide, please.
Thanks, Sheila. So we did touch upon these. This is just on a slide for your reference. This maximizing performance data self-assessment tool. Okay, so is this like a quiz that you take in a magazine to find out if you are, are you a fall, a spring, a winter? It's that kind of thing. Like, where is your organization? And they ask these questions that Sheila kind of went into. Now, the great thing about this tool is that it's something that our folks developed, but it can be easily adjusted to your situation. So take a look at it and see if there are any questions that really resonate with your SNAP ENT situation and SNAP to Skills. And there are these 5 corresponding levels. It dives pretty deep. Moving on to the next slide. Sheila referenced these key questions. And again, these are what we used, but it gives you something to think about for a self-assessment tool for yourself or your organization. These are pretty broad, and I think they're applicable generally. Next slide. This is what it looks like. Now, this is just a snapshot on the screen. All of this is available publicly on our website, and we'll give you a link to that at the end of our presentation, and we'll encourage you to go check it out if you have interest. This is sort of what it looks like, and you can see how it was designed to be visually appealing and to be interactive. Next slide. So you've self-assessed. You've determined if you are, a fall, winter, summer, spring, whatever your situation is. What are you supposed to do with that? This is where you figure out what this means to you specifically. And this is what the cohort had recommended. It's not fancy, but it's very useful. It's a template for the next steps. We all know it's a great plan unless you put down the steps about how you're going to get there. This is, again, available. Template is available. Anybody can use it. It's simple, so even if you aren't going to use this specific template, it's something to get you thinking about. What do you want to do? How are you going to get there? How long is it going to take? Who is responsible? And the most important one here is, how will you know when you're successful? What does success look like? So great options for a simple, user-friendly template. Okay, next slide. I'm going to pass it back over to Sheila, who's going to talk a little bit about the facilitation guides to help you all talk about these things. Sheila?
Thank you, Christina. So our facilitation guide, first, you have to complete the self-assessment tool and determine, what next steps that you're using, that you need to make in order to move forward. So the model in general is a resource intended to help you diagnose where your state is or where your organization is, and using performance data to demonstrate your programmatic achievements, your challenges, and your stakeholder return on investment, as we've said before. Then you would use the model to determine, your next steps. So you've collected this information, you've done your self-assessment. What does your data demonstrate about your achievements, your challenges, and your return on investment? Use the facilitation guide to figure those things out. You would draw from that from your resources and your tools, which we have on another slide. Next slide, please. So how do we maximize your facilitation guide? First of all, there's no right or wrong way to use the model. You can use it in several different iterations and figure out what works for you. You can also you can choose to change it, modify it for your model or for your establishment. We recommend that it can be used virtually. You may have state teams that are in different locations, offices that are in different locations. You can use it virtually, and you can certainly use it in person, in face-to-face settings. This particular cohort, they had several virtual meetings, and then they had a 2-day in-person meeting. Next slide, please. So I'll talk a little bit about the state action plans, and then I'll turn it back over to Christina. But basically, these are some key takeaways from our state action plans that the 6 states developed. Christina, do you want to talk a little bit more about those?
Sure, absolutely. So, okay, let's recap for a minute. We have all these self-assessment tools, so now you know where you are. You have your next steps going on, so you know where you're going. You have the facilitation guide, so it's like a ready to go, already packed up. You can follow all the directions. It lays out for you to develop your state action plan. So what did this cohort want to do at the end of this with their data? Okay, great, we have all these things that they were trying to address, but what did they actually do? The state action plans, you can read in depth. They're terrific. They're on our website, Workforce GPS, which we'll provide a link to. Here are just some highlights of the things that they did. One state wanted to work on team building, sort of getting all on the same page, understanding that we're all sort of a family is the word that they use, so that we can all share our data. It doesn't belong in pockets. Break down those silos. Some wanted to do better dashboards. Some wanted to integrate the referral process, and I heard a little bit of discussion about referrals previously. Some wanted bigger, more governance-oriented statewide agreements about data governance. So that was a little bit more broad of a goal. Next slide. Some other states wanted to get some good data analytics teams together, figure out how to take a look at this data. Others just wanted to create opportunities for their local areas to look at the data and understand it. Some wanted to build business intelligence capacity. So you see, it's super wide-ranging. Everybody had a goal and some state action plans that were right for them where they were at that point in time in order to move them forward to better use their data. And to do that, they also developed some additional resources. And with that, I'm going to turn it over to Sheila, who can talk a little bit more about where you can find some of these resources if you're interested. Sheila?
Thank you, Christina. Next slide, please. So that hyperlink there will take you to our Workforce GPS page. And we have all of the resources that were available that were developed for the our data maximization project or our data maximization model. So you'll find the self-assessment tool, you'll find the state plans of the 6 states that participated, you'll find of course the data development model, and you'll also find a wealth of resources that the state teams identified. The resources are in many different categories. I encourage you to, even if you think you may not use the model, I encourage you to at least go out and look at the resources. The resources are divided into federally required reports, key data sources, data quality and data validation, data visualization applications and tools, data visualization examples, using and integrating data, data governance, professional development, team building and building trust, data analysis, and evaluation. So if you visit the site, again, all of the materials that we talked about today are there. All the tools for you are there for you to use if you choose to. Next slide, please. Oh, okay, we had another slide. We had a slide that if you have any questions that we may not be able to get to today, we had a website. An email address that you could send us a message. That email address is etaperforms@dol.gov. That's etaperforms@dol.gov. So if there are any questions you have about our data maximization model, please send us a message if you're not able to ask your question today, or if we're not able to get to your question today. Thank you very much for listening, and I'll turn it back over to. I guess I'm passing it on to Andrew. Thank you.
Actually, I'll step in here a minute. Thank you, Sheila and Christina, and that was really interesting. And I think as we hear from Washington and Pennsylvania next, it'll be clear how the DOL, Department of Education tool connects up with many of the issues that SNAP-E&T agencies are wrestling with. I did just want to mention we will share everyone's presentations with all of you listening after the webinar. So you will have access to the DOL resource slide and all of the other slides. And Sheila, we can add in that email address at that point before we send out the slides. So with that, let's turn to Andrew Prehar with Pennsylvania SNAP-E&T program. Andrew?
Thank you, Julie, and good afternoon, everybody. So in Pennsylvania, we use data to assess and improve our SNAP-E&T program at several points in the process, and I'm just going to highlight a few of those points today. If we can move to the next slide, please. So we start our use of data in Pennsylvania early on, integrating it into our decision-making process regarding which third-party organizations we choose to partner with through our SNAP Employment and Training Program. We regularly review unemployment rates for each county in Pennsylvania and many of the cities in Pennsylvania that are provided by BLS, as well as in some cases our state labor agency. We also review the official high priority jobs list that is published by each local workforce development board in Pennsylvania to see which jobs and thus what type of trainings are in the greatest demand. We don't exclusively base our partnership decisions on this data, but it is a very important element that we consciously consider when determining what types of organizations we want to partner with. We also track unemployment rates to determine which counties are likeliest to lose their waivers from the ABAUD time limit. We match this data with our internal MIS data on the eligibility side to figure out the number of individuals not exempt from the time limit in each county. Then we focus ENT efforts on the counties with the most at-risk ABAUDs. So while our ENT program does serve volunteers as well as ABAUDs, there have been several times in the past few years where we have decided to launch partnerships specifically because we wanted to make sure that we were serving at-risk ABAUDs in an area that was at risk of losing a waiver or which did lose a waiver. So for example, our biggest city in Pennsylvania, Philadelphia, retained a waiver from the ABAUD time limit when the statewide waiver went away in 2016, but Pittsburgh did not. So even though Philadelphia is the largest city, we focused most of our initial SNAP ENT expansion efforts on Pittsburgh to make sure that ample opportunities were available for able-bodied adults there as the employment situation was also doing better there. In conjunction with the above-mentioned approaches, we also analyze participation data, and we feel that can help states determine when to expand the scope of an existing partnership to new tracks or new initiatives, which would allow states to focus expansion funds on the highest performing current providers. Next slide, please. So in a similar vein, data can also be used to project costs for a state's ENT program, something which is especially important in Pennsylvania, where some portions of our ENT program are funded through dedicated state appropriations from our General Assembly and others through a third-party match. In Pennsylvania, we issue participant reimbursements typically through a process called the special allowance process. Special allowances are issued by the local eligibility office, and we match federal funds with dedicated state dollars to fund this program. We find this to be a compelling alternative to having each third-party partner issue their own participant reimbursements because it ensures that a uniform level of supportive services can be issued to individuals no matter which third-party partner they're participating with. It also ensures that participant reimbursements are not issued or not issued arbitrarily, and that every participant receives proper notice and has due process throughout the process of being issued a participant reimbursement. Operating this program is immensely complex, and it does require us to accurately estimate our funding needs for what is essentially, from the participant's perspective, an entitlement program. If they meet the criteria, they get the special allowance. And as our SNAP ENT program continues to grow, this becomes even more difficult as past expenditures can only be so predictive of future growth. By regularly analyzing the data on our special allowance program expenditures in the past year, growth from the prior year, and the expected effect of any policy changes, we're able to model and make a well-informed annual estimate for our budget office on how much state and federal participant reimbursement funds will need to operate the program in the coming fiscal year. And so that if we could move on to the next slide, please. So another important aspect of leveraging data is ensuring that it is collected accurately at the ground level. In Pennsylvania, all of our third-party partners are required to use the Commonwealth Workforce Development System, or CWDS, which is a computerized case management system that we use in Pennsylvania for our human services programs, as well as for many programs operated by our state departments of labor and education. CWDS is accessible to varying degrees by third-party partners, SNAP eligibility office caseworkers, and the local workforce development boards. Data from CWDS also synchronizes nightly with our eligibility MIS. This allows the third-party partner case manager and the eligibility office caseworker to share vital information and ensures that everyone is working off the same figures. Each individual component a participant participates in is tracked individually in CWDS. It has a start date, an end date, and the number of weekly hours of participation in each component is also logged. This is crucial for the eligibility office caseworkers so that they're able to issue special allowances that are reasonable, necessary, and directly related to the individual's participation in the particular employment and training component. It's also really crucial for a bunch of other reasons, such as ensuring that we're properly enforcing time limits that we place on certain components in Pennsylvania, as well as ensuring that the eligibility office is able to pass along information on when an individual loses their eligibility for SNAP benefits and thus their eligibility under the SNAP ENT funding stream. All of that information is seamlessly transmitted from our MIS to CWDS and vice versa. Next slide, please. So in Pennsylvania, the core way that we use data in our ENT program is to monitor the performance of each third-party partner individually as well as in groups. CWDS includes a built-in reporting function, which allows the state agency to run both standard and ad hoc custom reports. We can also grant this ability to each individual third-party partner upon request so that they can generate the exact same reports that we're seeing. Our standard monthly report includes the number of individuals currently participating at each third-party partner's program at the end of the month, the number of individuals who exited that program during that month and overall in the current fiscal year, and of those leavers, how many attained positive outcomes, graduating from the program, obtaining employment, obtaining a credential, or some combination thereof. These codes all align with our component measures that we write into our SNAP ENT state plan each year so that we can see how each individual contract is doing in terms of attaining outcomes that will be reported in our outcome measure report that we submit to FNS at the end of each year. We also require each third-party provider to send us a roster of all of their SNAP ENT participants each month with their invoice, which allows us to grasp how many individuals are being served by each program and at what cost. Next slide, please. So as many of you may know, SNAP ENT originally became part of the SNAP program when it was signed into law by President Ronald Reagan as part of the Food Stamp Act of 1985. And we all know President Reagan's favorite expression was to trust but verify. And so a really good use of data within our SNAP ENT program is to make sure that we're holding our third-party partners accountable. So by running those monthly reports I mentioned through CWDS, we are able to get an accurate view of which contracts are under and overperforming expectations. The outcomes tracked in our monthly report align to those included in partner contracts, and so both the state agency and the partner can regularly check to see how close they are to meeting their benchmarks for the year. Data reported can also be compared with my team's annual in-person monitoring visits and the observations we make when visiting each third-party partner. We do case reviews from CWDS as well as client interviews, and that provides our state agency an opportunity to ensure that partners are correctly entering data and not incorrectly entering that data. Luckily, both our in-person monitoring and our data have confirmed the great success that our 50/50 program has enjoyed in Pennsylvania. But should an individual provider ever begin to underperform, data would be able to serve as the backbone of our rationale for corrective action. Our team also compares the participant rosters that each provider submits with each invoice to the actual participants listed in CWDS to ensure that providers are not inadvertently billing for individuals not enrolled in SNAP ENT or not receiving SNAP benefits. On the rare occasion that an ineligible individual is included on the roster, for example, someone who is open in CWDS but in hold status because they missed a renewal for their SNAP benefits, we can reach out to the provider to have them submit a revised invoice and roster which does not bill for that individual, thus ensuring that federal SNAP ENT funds are being spent as intended. Next slide, please. So in Pennsylvania, as I mentioned a little earlier, we've aligned all the termination codes that are used in CWDS, our state's case management system, with those used for component outcome measures in our SNAP ENT state plan. So within CWDS, there are, in addition to a regular hour tracking that providers are required to complete each month, where they state how many hours an individual is participating in each component that they're currently enrolled in. We also require them to enter termination codes when an individual stops participating in each component, which is called an activity termination code, as well as when they discontinue participation in the program overall and discontinue their participation in SNAP ENT overall, which we refer to as a project termination code. When paired with the Memorandum of Understanding with our state labor agency to access quarterly wage data, we're able to use these termination codes to very simply compile our annual outcome report for submission to USDA. We can simply use that data that originates in CWDS to run reports of each quarter of SNAP ENT leavers. Since the data from CWDS is sent over to our MIS, we're able to pull all that data out of either CWDS or the MIS. It's an exact copy that allows us to immediately link to each participant's social security number and other demographic data that is present in our MIS. And then that file can be sent over to our state labor agency under the MOU to obtain quarterly wage data that is disaggregated in the way that is required for SNAP ENT outcome federal reporting, as well as it allows us to parse each individual component to see how individuals performed in terms of the termination codes for each individual component in our program. Next slide, please. Okay, and I wanted to thank you all for hearing what we had to say about Pennsylvania's program today, and I'll turn things over to Julie.
Thank you, Andrew. That's a really impressive set of work Pennsylvania is doing with its data. We'll hear now from our final speaker, Shavana Howard, with the State of Washington SNAP Employment and Training Program known as BFET. Shavana?
Good morning, everyone, and thank you for having me. I'd like to do an overview on how Washington is using data to improve our program measures. Next slide. So the goal of our program, and I'm sure many of your programs, is to help people become employed, help them to reach their fullest potential so that they don't become reliant on public assistance programs. We do that through offering our Basic Food Employment and Training Program, which we call BFET, to any individual who's receiving basic food assistance within our community services offices. Next slide. This here is a lot of information, I know, on one slide, but it's a snapshot of the history of our program. And I included it because I wanted to provide an overview so that you can see the number of individuals and providers that the state support in operating our program. It also provides background and information regarding the amount of data and how important the data is that we're capturing so that we can identify program growth and we can request funding, whether that's through state agency or through the legislature. We also use our history to do analysis on staffing needs and support to providers and anticipate additional providers who are coming on board in future years. Next slide. Today, BFET is part of Washington State's Comprehensive Workforce Development. We have served more than 84,000 individuals since we started in 2005. We bring in over $20 million into the local economy by partnering with community-based organizations to provide our services. And we strive to help people obtain employment. Our entering employment rate for all of our participants is over 60%. We did see an increase in that data over this past fiscal year to 64%. Next slide. This is just a visual so that you can see the number of BFET providers that we have throughout the state. In Washington, we operate solely a 50-50 partnership So all of our services are delivered by community-based organizations throughout the state. We are in 34 of 39 of the counties within our state. We partner with all of our community and technical colleges, as well as 44 community-based organizations, in addition to 12 who specifically provide services for refugee and immigrant families. And we also partner with four tribes throughout our state. These are the providers that we provide support to. Our program only uses our 100% foreign funds for administrative staff. Next slide. So now I'd really like to focus on the different types of performance measures that we have within our state. We, of course, as all of you know, have the national reporting measures. We have some internal CSD program measures, which are part of our state's and our agency's strategic plan. And then we also have our provider success measures that we capture and report out on. Next slide. So the FNS annual reporting measures, as many of you already receive, these are the required reporting measures that we have to provide to FNS on an annual basis, and that we submit via the annual report that's due in January, as well as what we submit into the 583 report. This allows us to track the success of our clients and their completion with all of our programs. It helps strengthen our request for funding. And we're allowed to drill down to a lot of information, a lot of demographic information, a lot of component and participant information, thanks to our MIS system that we call EJAS. It stands for Electronic Jobs Automated System, which is where all of our reports, our reporting measures are captured by our community-based organizations. So through this system, all of our participation for our individuals are tracked, all of the component activities that they're engaging in. We track all of the employment outcomes. We track in our EJAS system all of the support services that are issued to our clients by type for each agency, which allows us to better tell the story of the services that we're providing here in Washington. We also track, of course, the number of individuals that are engaging in ABOT activities. Next slide. So the CSD performance, the CSD program measures are tracked for several reasons. In Washington, we are required to develop an annual legislative report that is due every November to our legislation. And this report simply tells the story of our participants from the time they enter service to the time they become employed. It provides demographic information for the legislature, as well as wage progression information. It provides program overview and highlights, and any strategic plans or measures that we have completed over the past year or that we anticipate identifying in future years. We also use our data to submit our annual legislative report, like I said previously. Over this last year, we've really started using our data to identify the number of basic food clients that are actually receiving BFET services, and then the impact that it has on SNAP churn. We know that in 2018, the number of basic food clients who participated in BFET was about 6% of our basic food population. However, those who participated in BFET were 65% less likely to come back on basic food. Can you go back one more for me? Oh, sorry, I covered all that. You can go to the next one. We review provider performance, comparing anticipated goals to actual goals. And this is done through our quarterly provider meetings and is used to improve future budgets and current budgets. And we also use our program measures as part of our 5-year strategic plan, which of course has a 5-year cycle and includes identifying program goals, areas of improvement, how we identify areas that are currently underserved, or in an area that is not represented by our program. On our strategic board, we do have the local workforce boards, we have employers, we have other state agencies and DSHS staff, so that we can provide we can identify the specific goals that we would like to accomplish and ensure that they're aligning with the goals of the state's workforce development system as a whole. Our provider success measures change typically every year. Our providers provide us with specific data as far as the performance measures that they feel like they're going to be able to reach. And so we are able to track their performance from all of their components. We are also able to receive data from our Employment Security Department, which tracks all employed individuals within our state. And we track that information for up to 8 cohorts. We receive updates every quarter, and we provide outcome measures to our providers as far as if they're meeting their performance measures and having people enter employment. As a program, we have over 62% employment rate, and that varies based on the providers. We have several agencies who are very high and that are able to engage people in employment and have them come off of basic food assistance. And for those agencies, we do partner them with other agencies whose success rate isn't as high, so we can identify challenges and areas of improvement and provide better support to our partners. We use all of this data to identify performance gaps. And some of those performance gaps we use, an example would be our SNAP ENT pilot that we have RISE. We really use our data to identify the individuals that we were currently serving that were successful, and the individuals that weren't successful. The data allowed us to see perhaps why they weren't successful. A lot of the individuals who aren't successful in our program, so that's the remaining 38%, a lot of them were homeless. A lot of them didn't have the necessary skills they needed or the credentials to obtain employment. And some of them just needed additional training or some new strategies or ways that they can work better with partners or with communities and with employers so that they can obtain employment and maintain employment. Next slide. So this slide shows the administrative of the program administration. We like to first identify the current outcomes, really to set a benchmark so that we can improve on those outcomes. We review, like I stated previously, performance measures every quarter to ensure that providers are meeting their goals. We know that if they're not meeting their goals, it oftentimes means that there are funds that are being left on the table because they're not serving as many clients. And so to ensure that we're utilizing all of the federal funds that we have, we're constantly having conversations with our partners of if they're reaching their performance measures, and if they're not, would they anticipate reaching for the future, any changes they've had in the program, any new strategies or outreach methods that they've created so that they can actually reach their numbers. And it's at this time that if we realize that they're not consistently reaching their numbers, usually it's 2 quarters or more based off the data that we pull, we will re-enter into contract negotiations and likely remove funds from that agency so that we can redistribute to other agencies. It helps in holding providers accountable, and it also helps with our program growth and our program improvement and integrity. Next slide. So one of the things that we did this past year to identify the program needs, and it's a little different than using the typical data that we have. Like I said previously, we had over a 62% employment rate, so the data showed that we were getting our clients jobs, and that's what the goal was. However, we didn't have a way to identify if we were providing services and resources to our partners who do this work every day and are truly the backbone of our program. And so we historically contracted, we did a survey internally with our DSHS agency, our research team. However, that survey didn't see a lot of participation and wasn't enough for us to identify areas of improvement so that we can provide better support and better training to our partners who do this work. So we reached out to Seattle Jobs Initiative, and we contracted with Seattle Jobs Initiative, and we wanted to have them conduct a survey for us so that it was objective and that we can receive some true, honest feedback from our partners on how we can improve service delivery, and also use it to create a benchmark so that we know at what point we're actually moving the needle on the support and guidance that we're providing to our partners who are actually delivering the service. The survey was, the participation for the survey was much higher, actually like 150% higher than the survey that we conducted as a state agency. And we used that survey to inform the direction that we moved our program in over this past federal fiscal year, and we'll continue to use it over the next federal fiscal year. But the survey, some of the feedback from the survey and some of the changes that we made as a result of the survey is we identified some of the challenges and miscommunication in our program structure. Historically, we had a BFIT operations and a policy team, a small team compared to our other state teams. However, they were not under the same administration. So sometimes one program receiving two different messages can cause miscommunication amongst our providers. So as a result of the survey, we have combined our program. So we have one administrator overseeing both our policy and operations to ensure less or to help in decreasing the miscommunication to our partners. We've also streamlined our process from invoicing, contract monitoring, onboarding, and the type of support we provide to our providers. Our quarterly reports, our quarterly provider meetings that I discussed earlier, were a result of some of the feedback we received from that survey. And during these quarterly meetings, we discussed performance measures, any policy changes, any contract monitoring outcomes, and any areas of program compliance that we've seen with all of the agencies. This past federal fiscal year is the first fiscal year we've actually started the quarterly provider meetings, but we have already seen after a review of Q3 performance how effective they are. A lot of our providers who were not who weren't meeting their performance measures are now either exceeding or at least 75% closer to the performance measures than they were historically. We also learned from this survey that our providers wanted their voice to be heard. They wanted to have some type of voice in changes that were occurring within the program, as well as not necessarily the writing of the policy, but operationalizing that policy. So as a result, we established several work groups so that providers can provide feedback and comment and help move the direction of our program over the coming years. We created a work group for increasing BFIT referrals, and this is where our providers identified that we don't receive a lot of referrals, they don't receive a lot of referrals from the state agency. And so we worked with our agency field staff who do the basic food eligibility on trying to provide them with resources and tools on increasing their knowledge of the program and the providers that are available to provide assistance within their communities. We also implemented a provider work group for our handbook, which is our guidance for policy and operations. And they really identified the gaps that were in the policies and the operational procedures that we have in our handbook. And so they were able to provide a lot of feedback and input into the changes that need to be made. And that has helped tremendously. I believe that it's going to help reduce the number of policy clarifications and operational clarifications and contractual monitoring findings that we received this coming year. We also convened a BFIT website overhaul, where our partners pretty much told us that the website wasn't functional for them. And so a lot of them may not have been using it, or clients weren't able to access it to identify agencies within their area. So we completely revamped that website and made it definitely more user-friendly, and has seen an increase in 85% of the traffic who are actually accessing the website to obtain program information. And then we also created a partner peer mentoring work group. This partner peer mentoring work group was actually a concept that came out of one of the Snap to Skills Academy that I was able to attend 2 years ago. And the state of Minnesota community partners got together and created a procedural handbook on how to be a good partner mentor for current and newly established employment and training programs. And so we used that guide that Minnesota had already provided, and we convened a work group with our community-based organizations, and we are working to create a process, a peer mentoring process for our providers in the future. We anticipate we anticipate conducting this survey every 2 years to ensure that we are actually making progress and moving the needle on providing support and resources to our partners who are doing this amazing work on a daily basis. The survey itself actually goes all the way up to our governor's office. So we provide the survey, and we provide it with feedback on work that has been done to move the needle, or goals to intentionally move the needle, so that we can show the increase in the support and the technical assistance we're providing to our partners, which in turn will hopefully show an increase in our performance measures and outcomes for the program as a whole. Next slide. So there's a lot of benefits to tracking of data. It definitely strengthens our story and our client story. It assists in providing the resources that our providers need to help our clients to reach their full potential. It allows us to request support and increase funding, not only from FNS and the legislature, but also from DSHS staff. It has helped tremendously in letting our leadership know the needs of our program as far as the staffing and the capacity to better support our providers. As you saw probably in the initial history slide that I showed earlier, when we started BFET back in 2005, we didn't even have a dedicated FTE for the program. We got a dedicated FTE for the program as a result of our data in 2012, and we have since increased our staffing to support the BFET program from the 0 FTE that was really not focused on BFET in 2005 to now we have a team of 28 who completely support the basic food employment and training program. And they do that because of the data. The data was able to tell us the what, why, when, where, and who of the individuals that need the support, the clients that are being served, and the number of providers that we have coming on board to provide services. Next slide. So there's a lot of data that we pull on a quarterly basis to track the program oversight. We definitely look at funding. We look at support service by dollar amount, by agency, and by type. We're looking at the amount of state funds that we use to operate our program compared to the federal funds. We are looking to see how many of our able-bodied adult without dependents are actually participating in the program to meet the work requirements. We are checking to see, the counties or the regions that are actually participating in the program, and that really helps to inform our 5-year strategic plan and identifying the areas that we need to provide additional resources and services in. And then we identify just some demographic information to kind of better tell our story. Next slide. So BFET is able to impact not only the local communities, but our state as a whole. It allows us to expand the funding that already currently exists in the area. It allows all of our providers to increase the capacity that they have to grow their program. It supports our agency's mission of transforming lives, which is really allowing individuals or helping individuals to reach their potential so that they're not relying on public benefit programs. We're able to see the success in our program, and we're able to identify the need and really hone in on what we need to work on in the future. It allows us to expand on our services and our delivery. Washington historically has not taken advantage of all of the components or the elements that are allowed under SNAP-E&T. However, as a result of the data and as a result of our partners' needs, we are moving forward with starting to actually increase those elements of SNAP-E&T, for example, like work-based learning, which we currently don't offer within our state. And then we also use our data to expand our program and to seek out additional partners who can come on board for our program. We have a lot of moving parts within our agency, and so we often share the data not just on BSET, but also on our basic food population, so that we can build relationships within the community, identifying the number of individuals who are on basic food assistance, and also identifying the individuals who appear ready to actually move towards employment. And we're able to do that based on all the data that we pull on a monthly and or quarterly basis, so that we can make a change within our agency and within the communities that we serve. And then lastly, as a result of our ability and our MIS system, we have received a lot of national recognition because of our outcomes. Every time I speak to the employment measures and the outcomes that we have, and we say 64%, but we're trying to increase, people are often just surprised that we have employment outcome measures within our program of 64% or 62%. We're always looking to improve. In order to improve those outcomes, we first have to identify where we're at and then set strategic and measurable goals so that we can improve and increase those employment measures. Next slide. And as you all know, this is a huge effort. We can't do it alone. We partner with the State Board for Community and Technical Colleges, the local counties, the workforce development boards, several community-based organizations throughout the state, the Employment Security Department, to provide all the resources and support so that our program can be successful. Next slide.
Thank you, Shavana.
Thank you.
That's a really interesting and impressive journey that Washington has been on to grow its SNAP-E&T program as much as it has. So I'm going to turn it over to David Kaz now, who will open it up for the questions that you've been submitting during the webinar. And just as a reminder, you can continue to submit those through the chat function. David?
Yes, thanks, Julie. So presenters, if you want to unmute yourselves, we can ask some questions here. So first question is for Andrew and Shavana. If you have a fairly new SNAP-E&T program and are only doing the minimal participant tracking, the 583 report right now, but you really want to start using data more robustly to improve your program, what would you suggest as sort of a first step to building that out? What's most important?
I guess I'll go first. This is Shavana. I would say identify all of the data mechanisms you have in place that you can track. So what we did and what we continue to do as we expand is we ask the question of what do we need to show program outcomes, show program measures? How do we show skill gains? How do we show, the age of individuals when they come into our program? How do we show them the components that are being used? So I would first identify the areas that you're wanting to track, and then identify where in your system you're able to track that information. I've talked to several states, and many of them don't have a system that they're able to track the components or outcome measures as far as if an individual is employed, if they go on and off of basic food assistance. And so I think it would be very difficult if you don't have that system in place. So you first have to identify what information you want to track, and then where you can actually, which systems or tools you can use to pull that information out of.
Great, thanks, Shavonna. Andrew, do you have a comment on that?
Yeah, I would mainly just echo what Shavonna said and say that it's really important to make sure that you're tracking individuals both within the components they're participating in, as well as by individual third-party contract. So I know the person who asked the question was referring to the 583 specifically, where things aren't necessarily broken out by individual contract. But in Pennsylvania, we felt it was just so important to have our data broken out. Whatever data you decide to collect in terms of outcomes, have it broken down by individual contract and by individual component, because it allows you to see which components and which programs are being the most successful, which really helps with your planning from that point forward of how you're going to grow your ENT program.
Okay, great. And also for our states, question about, once you have a more comprehensive system in place, which includes working with and verifying a lot of sources of data, how do you staff that up? Do you have a team of people doing that? Is it a single person? How much effort does it take?
It takes a lot of effort. We have a data team within our agency, and we meet with them usually every quarter or anytime a new report is needed. And we tell them our needs. So we identify, like we are rolling out our job retention extension policy, and so we had to meet with them and tell them this is the information that we need to capture. We need to know when an individual becomes active on the program, when they start using the component, when they leave the component or the component closes. And our IT staff, our data team, they ask a lot of questions to make sure that they're pulling the information from the right source. And so you definitely have to have a lot of communication with your IT staff in supporting any additional reports, mechanisms. We've had it in the past where we didn't have a lot of communication. We didn't have the standing quarterly meetings or the staff to do that work. And they were pulling the data from the wrong data sets, which in turn causes misinformation that we provided to our providers regarding their performance measures. So we do have one FTE that's designated to our program. They work on other things outside of BSET, but there is an FTE within our data shop who we meet with regularly, who understands the program, and who we discuss all of the reports to make sure we're pulling the right data sets and if there's questions on any of the data sets. So your agency would have to have a data person who could be at least the one person, because if you change too much, you'll lose some context and history of anything that's been done historically. So at least one FTE from your data team, and then current BSET or current ENT staff to clearly articulate the data needs.
Great, thank you. Andrew, do you have anything to add in terms of your team?
Yeah. So in Pennsylvania, my team that I lead focuses mostly on the policy and programmatic elements. However, we work very closely with both an in-house data team within our bureau, as well as a different data team that exists within our Department of Human Services more broadly, and that's really vital as well. Especially we're very the way that we divide up work is very specialized in Pennsylvania. So our ENT program actually has 3 sets of contracts that are actually monitored and run out of 3 different units So really having another unit that works on the data and the systems piece of things and can kind of unify data points and track consistent outcomes across all three of those different program groups, those contract groups that are being handled by three different teams, that is really valuable and I think really essential. It'd be hard to track how our programs are all doing relative to each other without that.
Great, thank you. So I think we have time for maybe one more question, and then I'll turn it back over to Julie to close the webinar. There seems to be, there's a few questions related to the importance of partnership in developing and analyzing data between state SNAP and SNAP-E&T agencies and departments of labor. So I'm wondering if we can hear from the group on how you develop those partnerships. Maybe Sheila and Christina, you can address that from the national level, whether you're seeing some of the state workforce agencies thinking about partnering with their human service agencies or not. And I know, for example, in Pennsylvania, you guys have an MOU. So anybody want to weigh in on how you develop those partnerships?
Oh, sure,
DOL, are you there?
Yeah, this is Christina from Employment and Training Administration. So that is one of the things you should take a look at when you are making some plans about how to collect and analyze your data and your partners. You know, SNAP is one of the partners that should be in the AJC and should be involved in the American Job Center. Some states are far more engaged with their SNAP folks, especially with E&T, than others. And so this is an excellent time to ask the question as to how engaged are we? The data is slightly different. And one of the challenges that we have noticed for states that are interested in getting more engaged with SNAP or sharing SNAP data is a major challenge is the fact that we're not always talking apples to apples here, and the data systems are not always connected or very rarely are. So those are two major challenges. And the states that are best poised to partner with their SNAP in terms of not just serving folks who are receiving benefits, but also looking at that data in a holistic manner, are those who have existing data agreements. And so we've talked a lot about that on this call. So I would say, please, if you are not currently approaching your state workforce boards or reaching out to your state departments of labor to find out more about partnering opportunities or data sharing, to go ahead and do that, because I do know that our states are very interested in as much data and data sharing as they can get. And this is evolving differently in different states. So if you don't know who your partners are, you can reach out to Sheila and I, and we'll be happy to get you connected with the right folks.
Great, thank you, Christina. So I think we are out of time. I'll turn it back over to Julie just to take us out. Julie?
All right, thanks, David. Just wanted to thank all of our speakers today for taking time out of their very busy schedules to share their insights with all of our participants on the call. As a reminder, we will be sharing their presentations with you, so look for that sometime in the near future. And thank you all for participating in the webinar.